Good to have you join us on Health Matters. Welcome to the show. I am Yomi Otaigbe. Unhealthy diet, physical inactivity, tobacco use, harmful use of alcohol. What do these have? What impact do they have on human health, particularly when we talk about cardiovascular diseases? Medical experts in the field of cardiology will be quick to tell you that most of these risk factors are part of the things that bring about cardiovascular diseases. And with me today in the studio is a professor of medicine and cardiology at the Babcock University, Ogun State. He's also the president and CEO of Tri-State Cardiovascular Institute and chief division of catheterization and interventional laboratory at the University College Hospital in Oyo State, Southwest Nigeria. Professor Kamar Adeleke, thank you so much for joining us.
Thank you for having me here.
It's nice to have you here.
Thank you very much.
Now, the World Health Organization has said that cardiovascular diseases are the #1 killers globally. So, these diseases, if you say cardiovascular, what really are they?
Again, thank you very much. This is a major issue that unfortunately we are really lagging behind in the sub-Sahara. First of all, before you can tell what diseases are, you have to know what the normal is. So what is the heart? The heart is the structure that I call the engine of the automobile. In other words, without it, there is no any organ in the body that can function. So now, how do we define the heart? God made it. It's just a little tube that is divided into two. So we have what they call the right heart and the left heart. And each of these right and left heart is also divided into two segments. So we have the right upper chamber, the right lower chamber, the left upper chamber, and the left upper chamber and left lower chamber. Now, each these chambers they have what they call the gates that we call valves. So that is the heart by itself. Now, the heart also now is engaged in a structure to protect it. In other words, when you have trauma from infection from outside world. So that is what we call the pericardium to kind of contain the heart. In between the heart and this cage is a space that contain fluid. Now, this is again to lubricate the heart for cushion, just in case there's an impact. So that is part of the heart. Now, God then put some pipes that drain the blood from the body into the heart. And then some pipes that drain the blood from the heart to the rest of the organs.
Okay.
So that is part of the heart. So now, when you look at all those, these are what we call the mechanical part of the heart. But then there's also electrical. In other words, every one of us have pacemaker that God has put in there for us. So now we have the mechanical and we have electrical. Any of those that I mentioned, any abnormality in any of this, the component is considered to be part of the heart disease. So you can see now.
So it can be from the valve?
It can be from the valves.
The arteries?
It can be from the artery. It can be from the hole in the heart. It can be because of the muscle itself. It can be because of the space, because you have too much fluid or the fluid is infected. It can be because the cage is infected or affected. So then, in addition to that, the function of the heart is to pump the blood to every organ in the body. And the heart itself needs blood to survive.
Okay.
You see?
Like we have on the screen now, you can see the types of heart disease. And this would be the arteries, right?
Exactly. That is the artery that you are looking at. As I told you, there are blood vessels that drain the blood into the heart. We call that veins. And then there's blood that drains the blood from the heart outside to the heart. We call them the arteries. So now, any of those arteries now...
That is the normal artery.
To the left, exactly.
This is the narrowing of the artery.
And the narrowing of the heart. And that's just a segment. That is what caused the heart attack. When that one blocked off, and that is because of the... And you can see the heart now on our right side. That is the heart that had a heart attack, that had damage. because of blockages of the artery. Now, blockages of the artery is just only one component of heart disease, as you can see.
That's just one of them.
That's just one of many. That is the reason why you see when it comes to the training of the, after you finish your medical school, you've done your residency, then it takes you another 4 years minimum to do specialty in the heart disease.
So what is it, for instance, that will cause this narrowing of the arteries, for
Very
instance?
good. Now, if you actually look at us in Africa, or anywhere for that matter, before you will see that majority of the, you have to really also segment it, the children and the adults. Most of the children, they are congenital heart disease, and most of the adults are acquired, heart disease. But although they can have congenital, that's also manifesting. Now, the blockages of the heart disease, is number one, because of certain, we know what caused the blockage is the plaque. And what are the plaque? Is the consequence of the high cholesterol, the cholesterol buildup in those arteries. When they keep on building up, it's almost like a pipe that have all these, sway.
Then there could be a blockage.
And then there can be blockage. When there's blockage, then of course you can have a heart attack. Now, if we want to look at, that is just what causes the heart disease. Okay? Now, when you look at the incidence of the heart disease, particularly, that is basically what we're looking at now.
The causes of the heart disease.
Causes of the heart disease.
It could be diet.
Yes, it could be diet.
Aging.
Aging, as we all grow older, is the wear and tear that you see that can cause that. It could be genetics, because of the fact that people are just prone based on their DNA makeup. Lifestyle is a very modifiable, risk factor.
Like I was talking about tobacco use, harmful use of alcohol.
We do know that people who use tobacco, and thank God in Nigeria, I really do not see it. In fact, majority of people that use tobacco that I see are foreigners, at least where I go, in Lagos and everywhere. So yes, tobacco use, can be one of the major risks. Hypertension is a big one. If you look at it, maybe 1 in 2, sub-Saharan African have high blood pressure. High blood pressure is one of the risk factors.
Huge, 1 in 2.
It's a very, very huge one, yes. Particularly anybody above the age of 25. So, and people usually don't know until it has caused, too much trouble. Gender, those are the non-modifiable risk factors. Males are likely to have heart disease, than female until the female reach the menopause, because of the hormones that you guys have, particularly the estrogen, tend to really protect the female. But once you reach the menopause, then the risk is the same as male or female. Of course, diabetes is one of the major ones as well.
Yes, and you were talking about, children. You may not find a child, smoking. You may not find a child, living, sedentary lifestyle, because they are up and about.
Yeah.
So what will bring a heart condition in a child? And
I really like that one, because if you actually look at our experience in Nigeria today, we have done about 54, 55 open heart surgery. And I'll tell you right now, probably about 60% of them are children. And we are talking about as low as about 8 months old, to about 20 or 17 years old, children.
60%?
Yes, because remember I was telling you, that the reason for the heart disease in children typically are what they call structural. It's not their fault. It is during the embryology, makeup, during the differentiation.
Could it be something that happened to the mother when she was pregnant, or something that she took?
Actually,
in terms of food, in terms of
exactly,
medication?
that is very true. That is very true. Because medication have been shown to be teratogenic. In other words, they can cause defect. And that's what we always say. Your heart is formed within 6 weeks of gestation. From 6 weeks. So
the mother needs to be very careful.
In fact, the mother has to be very careful. Even if the mother smokes cigarette, that can cause trouble, with the kid. It can cause low birth weight. And as a result of that, they can have what they call the hole in the heart. So majority of these kids, they have the hole in the heart, they have the valve that is not, properly, placed, and that can really be the trouble for them. I mean, it's really amazing, the amount of children that we have. Right now, we have about 7 children that are going to be done in the next 2 weeks because they have various congenital malformation in their heart.
So if we have this high figure, at least from your center, what should parents be doing right now?
I think in the US where I practice, the most important thing is the screening. Every baby that is born, we screen them. You screen them just, number one, even during the gestation. We have what they call the, high level ultrasound that will be able to pick up, the kids that have congenital heart defect. And also too, the kids that have certain kind of syndromes, like Down syndrome, their risk of having heart disease actually probably close to about 70–80%. So if you have a Down syndrome kid, you are likely to have congenital heart defects than they're proven otherwise. And I think what we are not doing very well here is what they call the routine visit and care. When you go to see your pediatrician, they will be able to examine you, take the history, properly examine you with the stethoscope, then hear any heart murmur. That may be an indication, that you have to, go and see a cardiologist. And then tests can be done. And these tests can be done very early. The most important thing is that if you do it, the sooner you do it or the earlier you do it,
the better the outcome.
Exactly. We have some kids. There was a child that was just done recently because it was so late. Now that kid is probably not going to survive. Whereas if you have caught that disease very early on, most of the procedure will be very minor. In fact, we can do them without opening the chest now.
Okay, now some signs or some symptoms should also come with this, right? So let's talk about them for children and for adults.
Most of the time, the children, and by the way, we're talking of the blockages of the arteries. I have seen one. The youngest kid that I saw, with heart attack, when I was doing my training in Philadelphia, was actually, a 8-month-old kid. This kid had a congenital abnormality of what we call the coronary. The arteries, I told you, supplies the heart itself. But when the kid started running and walking, that was when it manifested. The kid was just sweating. The kids will just, get tired and then will not be able to move, or panting. Or sometimes they can just turn blue. If you look at their lips, they turn blue. Those may be the reason. So that is in children. But in adults, almost about 5% of people who have significant heart disease will not even have symptoms. What do they have? In fact, they will come dead on arrival. In other words,
that's where you hear somebody standing at the bus stop or somebody is giving a talk and just slumps.
And they just slump, and we have seen that. Now, thank God, majority of people will have some kind of symptoms. What are the typical symptoms? The typical symptom is that, I know I can walk up my steps, 20 flights, and without any problem, because I do that routinely. Now, suddenly now, when I take about 5 steps, I have to stop. And when I stop, then, the symptom goes away because I'm short of breath or I have chest pain. And then when I continue, it happens again. That is one of the symptoms that you're going to have. Some people will have chest pain. Some people will have palpitation, whereby their heart is just beating fast. Some people, they just feel sweaty. Some people, they just feel tired. Some people can pass out. Now, the people that I'm always afraid of are the ladies. Because the ladies can be having symptoms of stomach. It's just like stomach ache. I had a lady who was an ambulance driver, in Philadelphia, and all she came in with was belly pain. And they thought she had some kind of pelvic inflammatory
So the
disease.
symptom in women might be slightly different from that of men.
As a matter of fact, that's the reason why majority of the time the women's symptoms are very different. We have lost a lot of women in the 80s, in the early 80s, late 80s, because they don't come in with typical symptoms that I described to you before. And now we are beginning to know that females are different breeds. And any symptoms, what I tell my patients is, you know yourself, you are the best doctors. If something is just not right, either because I'm feeling dizzy, I'm sweating too much, or I'm just not myself, go and get checked out.
Especially if it's persistent, I guess.
Particularly if it's persistent. Don't say that I'm having belching. Belching can be. Don't think it's just because of the stomach, because it can be because of the heart. I mean, if you think about it, the number one disease in sub-Sahara Africa before 10 years ago was was communicable disease, like HIV, AIDS,
But now,
TB.
non-communicable
But
disease.
today, it is heart disease.
Okay, we'll just take a break, and when we come back, we'll be talking more about how to prevent some of these cardiovascular diseases and have a good cardiovascular health. Just stay with us on Health Matters.